why is this hospital here and what is its role? Is that?
Yeah, that's a great question.
Okay.
So there are a lot of patients that come from the West Shore, if you will, that would be traveling across the river to seek care at Hershey Medical Center. And the part of the Penn State strategy is to bring care closer to home. And so the strategy behind this hospital and also Holy Spirit is to be able to provide patients with that care in their backyard, keep them closer to home, and to fulfill that mission and strategy of Penn State Health. So this was really, that imperative to, as you said, serve patients, Perry County that doesn't have a medical center in its county, to bring patients, like from, Carlisle region, from the West Shore here, in just different areas, get them that care, Penn State health care closer to home. So that really was the reason and the decision behind putting a hospital in Cumberland County. And of course, with the addition of Holy Spirit, that's just an added bonus. So that we have two hospitals that can serve patients, in just different ways in the community, and be able to reach, more patients.
What's the approximate opening date?
October 1st is where we are gearing to open to patients.
What will the opening be like? I mean, will it open all at once, or?
It's a phased opening. So we will be opening up ED, of course, our women's unit, so OB, postpartum, NICU, or nursery. We'll have a med-surg unit open, and we will have our ICU open for day one. And then as volume increases, we will continue to open up the rest of the beds in the hospital in a phased approach.
And each of these bays, actually all the rooms in the hospital have built-in computer terminals to allow the staff to spend more time with the patient in the room. Certainly helps with communication and making sure that we're listening to the patient versus coming in and out of the room, which is disruptive. So this is the main emergency room where we take care of patients. There's multiple sides, and the bays go all the way around. There's 18. So they're all pretty much, they're all set up the same except for a couple that have assisted lift devices for patients who need assistance. And you'll see outside the door, you'll see these units tell us what the pressure of the room is. So when we want to create negative pressure, we'll adjust these either individually or through the whole unit. We have the ability to do that. There's another trigger that there's a little vent outside the door that indicates that it's a negative pressure room. An example of a lift device that would be used for patients that may struggle. It certainly keeps our staff healthier, that they're not having to move patients that are difficult to move. And all the monitors that manage their heart rate, their heart rhythm, their pulse oxygen level, their respiration, temperature, all are centrally monitored and displayed on those units.
This is the ambulance bay, so when EMS is bringing a patient to us, ambulance will come up through these doors where the patient can be received by our team of providers and nurses. Back behind here is for patients when we have hazardous situations. There's a decontamination shower back in here, along with our EMS providers have a station back in here where they can sit and and stay while they're here with us.
So this is our nuclear medicine machine. It could help us with patients who are having some cardiac testing, some testing around their bone structure. I don't know, maybe give some examples for nuclear medicine?
Oncology.
Oncology patients, certainly. Again, this is Siemens' latest and greatest equipment.
So this is a labor and delivery suite in here. Very nice, very spacious. So when mom comes in, mom will be back here on this side of the wall. A lot of nice space in here. There will be furniture here for dad or grandma, grandpa, whoever's going to be in the room with that mom during her labor. Once mom delivers the baby, this space over here where this head wall is, this is for the baby over here. So we're able to take care of mom and baby in the same space for the first few hours after birth. And mom, of course, has her own private bathroom over here. really important to moms. This space in here gives mom a lot of nice space while she's laboring to be able to just feel comfortable, and a lot of great space for staff to be able to take care of mom and baby. So this is where procedures would take place. So imagine a bed here that the patient would be placed on for surgery. All the boom equipment that we have here that it helps supply with some of the equipment, the power to that equipment, the lights. Anesthesia equipment is right behind you. So this is a really nice working space for our staff to be able to do surgeries in here.